happens?
So after we've confirmed that eggs are fertilized and have now become embryos, which are called zygotes, early embryos or one-cell embryos are known as zygotes. Zygotes. We let them grow in the incubator for a couple of days. And this is where it can vary from clinic to clinic, because some clinics like to look at embryos every couple of days as they're developing, while other clinics will just let them develop undisturbed for a few days. So some clinics will look at embryos on day 3, so that's 3 days after insemination occurs, while others will wait until day 5 in order to look at the embryos.
This sounds more and more like a sci-fi movie.
It's very technical.
Yes, yes.
So if embryos are looked at on day 3, if that's per the clinic's protocol, they're looking to see if cell division has occurred. So we talked about the zygote, the one cell embryo. But what actually happens is after fertilization occurs, that one cell embryo actually begins to divide into 2 cells. So this is something called mitosis. It's a different type of cell division where the DNA inside of the embryo, that one cell will actually replicate. So it'll make an identical copy of itself, and that one cell will divide into 2 cells. In that process, one set of the DNA stays with the original cell, while the new set of DNA actually goes along with the new cell. So what you end up with are 2 cells with identical DNA. And then those 2 cells will also undergo cell division. So then you get 4 cells and so on and so forth. And that's how our bodies operate too. Every cell in our body, except for eggs and sperm, replicate via mitosis. So this is very, very early development. So what we're hoping to see on day 3 is at least 6 cells. So from the time we look at an embryo on day 1 to the time we look at it on day 3, we expect there to be at least 6 cells in the embryo, although they do say 8 or more is ideal. It's not necessarily that an embryo with less cells it cannot be successful. They just have lower success rates than, say, an 8 or more cell embryo on day 3. So we want to look and see if the cells are dividing, if they're dividing at a normal rate. We also look to see if there's any fragmentation. So fragmentation can occur during this cell division process. Little fragments can actually break off of the cells during this process. And a little bit of fragmentation is okay. But if it starts to take over more than 20% of the embryo space, we consider that an abnormal finding on day 3. Again, doesn't mean that an embryo with more than 20% fragmentation can't be successful, just has a lower success rate. And then we also want to make sure that the cells in the embryo are roughly the same size. So as cells divide inside the embryo, they actually start to get smaller and smaller. So you have one big cell, which is pretty much the size of an egg, and that's your fertilized egg or embryo. But as the cell divides into 2 and 4 and so on, the cells get smaller and smaller, but the embryo doesn't actually grow in size. A lot of people relate it to cutting a pizza. So the pizza, you can cut it into smaller and smaller pieces. The pizza doesn't get bigger. The sizes just get smaller as you make more slices, right?
Yes.
So it's very similar to that. So you want to make sure that the cells in the embryo are roughly the same size, and that's to make sure that they're dividing at the same rate. So there are situations where maybe the embryo gets to the 2-cell stage and one of those cells starts to divide, but the other doesn't. And so if you see a very large cell and a lot of smaller cells, it often means that there's some kind of problem with cell division, and it's an abnormal finding on day 3.
Okay. So by this time, if it's abnormal, then you can just reject it?
Most clinics will keep those embryos in culture for a few days if they do, even if they look abnormal on day 3. And the main reason is because it's still possible for those embryos to grow. It may not be as common for them to grow, but there are situations where they can. And so instead of discarding that embryo, they'll keep it in culture, and if it grows, that's wonderful. If not, then it's not unexpected. And some clinics even do transfers on day 3, so they'll transfer day 3 embryos.
Okay. And why the difference? Why 3 days and why some a few days later? Does it make a difference?
That's a good question. It's a question that I get asked a lot, like what's a day 3 versus a day 5 transfer? Because a lot of clinics will do fresh embryo transfers, meaning the embryos aren't frozen on day 5. So there's a big debate about, is day 3 better than day 5 and why not? So there's really no right answer, but there's pros and cons to both. So a day 3 transfer is usually indicated when there's a lower number of embryos. And the theory is that you're taking those embryos from the culture dish and you're placing them into the uterus. And so that creates a natural environment for those embryos to give them the optimal environment for development. So instead of having them grow in the dish, you're technically giving them a better chance of developing inside of the uterus. Okay. So that's the primary reason. And sometimes what we see is after day 3, embryos do stop developing in culture. So a lot of doctors do think that day 3 embryo transfers give the embryos their best chance. Some of the cons, though, are the success rates aren't necessarily as good as day 5 embryo transfers, especially when only one embryo is transferred on day 3. And for that reason, a lot of clinics will transfer 2 embryos on day 3. And anytime you transfer 2 embryos, you run the risk of a high order multiple pregnancy, meaning twins or higher. Not that there's anything wrong with twin or higher pregnancies. There's nothing wrong with having twins, but it can increase the chances of complications for the pregnancy, for the carrier of the pregnancy, and for the babies. So a lot of doctors try to steer away from transferring multiple embryos to decrease the chances of high order multiple pregnancies. Another con of a day 3 transfer is preimplantation genetic testing cannot be performed on day 3. The embryo has to be a little more developed. So embryos that are frozen or that are transferred on day 3 are usually not genetically tested. I have heard situations where people have done PGT on day 3 embryos, but it's very, very rare. So normally they're untested embryos, which can also decrease their success rates. And really, we just don't know how the embryos will develop past that point. So it's hard to say because they either stay in culture and maybe don't develop as well. And one could argue that they would have developed better in the uterus, but you don't know because they're either in culture or in the uterus. So who's to say if they would have done better or not? It's difficult to say.
Yes.
Yeah.
So transferring of multiple embryo for older women, I understand this because as a woman ages, the entire the process of getting pregnant or her chances of getting pregnant decreases. And maybe that's why doctors transfer multiple embryos. And is that the reason why we see more twins being born of older women?
That's a great question. There are definitely situations where it is okay to transfer multiple embryos, especially when there's a history of recurrent implantation failure or recurrent failed transfers. Also, when the embryos might be of poor quality, you're correct. In older women, there does tend to be an increase in the transfer of multiple embryos. And a lot of the reason is as women age, there's a higher chance of the embryos being genetically abnormal. And genetically abnormal embryos can either not implant or can miscarry. It's actually the leading cause of miscarriage is embryos that are genetically abnormal. And so, yes, for that reason, we do tend to see more women who are over 35 either doing pre-implantation genetic testing on their embryos, or if not, they might have multiple embryos transferred in hopes that it can increase their chances of success. But another question that you sort of brought up is, yes, the incidence of twins is higher with IVF. And that is also because the chances of an embryo splitting are higher with IVF. And the exact cause of that is unknown. It could be because of ICSI, it could be because of freezing, it could be because we do assisted hatching on the embryos where we hatch a hole in the shell, which I'll talk about later. But for any reason, there is a higher chance of embryos splitting. And when that happens, you end up with identical twins. So one embryo actually turns into 2. And I don't know the exact number, but it's higher with IVF. Did you have any other questions about anything that we talked about today?
Why do you think they split? Is it normal? Is it not normal?
No, incidence of embryo splitting is higher with IVF. And again, there are multiple theoretical reasons for why the embryos do split with IVF. A lot of people argue that it could be from doing ICSI, the intracytoplasmic sperm injection, assisted hatching, which is, so embryos have to be able to hatch from the shells that surround them, which again, we'll talk about next week a little bit, or next time we talk. But what we do is we take a laser and we actually make a small hole in the shell to help the embryo hatch. There are some theories that that could increase the chances of embryo splitting. It could be from the culture conditions, the embryos being in the incubator. It could be from the stimulation medications that women take, or the medications to prepare their uteruses for transfer. There are a lot of theoretical reasons why it could happen, but there's really no way to pinpoint the exact reason. But regardless, yes, IVF embryos do tend to split more than naturally conceived pregnancies.
Right. You answered my second question, because I was going to ask you if it's more evident in ICSI fertilization or normal IVF fertilization. But
yes, I do believe it is. Don't quote me on that, but I do believe it's higher with ICSI.
Okay. All right. Researches are being done, papers are being done on these topics.
Yes, there have been research projects about this for a long time, and really there's just no definitive answer, because there are just a lot of factors, like we just talked about. There are so many factors that go into play, so it's really hard to say for sure if it's one specific thing that's causing it.
Yeah, it's fascinating because we see so much development and so much progress, and then you come back to a small thing and there's so many divided opinion by experts, and there's no concrete proof. Wow.
Yes, it's a little frustrating in the field because wherever you look, there are conflicting results, and it's hard to know what's true and what's not, or are they both true?
Yeah.
Or it's hard to have definitive answers.
Yeah, they could both be true under different circumstances.
Exactly. Yes. And what one clinic sees might be different than what another clinic sees. And there are just so many variables that are at play all the time. So it can be, there are just so many variables that go into every calculation and every result.
All right. Well then, thank you so much, Jessica, for your time. And
absolutely.
I look forward to seeing the email, and editing team will work on that.
Yes, I will send that email over to you now with those videos. And if you don't get them, let me know. And then, we can talk, maybe next time we can talk a little bit about embryo grading and embryo freezing and thawing. And maybe then another time we can talk about PGT, because that's a pretty complex topic.
Yes. And I think in many countries, it's against the law.
Yes, I don't know all of the laws specifically, but I do know that it's not permitted in some countries. Knowing the gender is not permitted in some countries. Gender selection is not permitted in many countries. It's a little bit of a controversial topic, but one that's still performed nonetheless. So.
Yes. Well, thank you. You have a very nice evening, and I will see you Monday evening at 8 p.m. your time.
Okay, that sounds wonderful. Thank you.
Bye.
Bye.